Good afternoon. How are you going? Hope you are good. Quick chat. Let's talk about Taylor Self, one of the Sevenistas, the good dudes, guardians of the methodology. Is it a sport, Sousa? Is it not? I don't know. One thing it is a tool. CrossFit is a tool for sharpening the fitness knife. That's what CrossFit is. If you don't want to call it a sport, it's a tool for sharpening fitness. And fitness can be a sport, we know, because we know Matt Fraser, we know Tia Claire, we know Rich Froning, we know James Sprague, we know Adler, we know Colton, we know they're a lot fitter than everyone else in the world. Alright, so it's a sport if you've got a competition, and generally with some physicality. So back to what I was going to start with, although I got railroad there by what is CrossFit. Taylor Self banned for 4 years for taking peptides as a therapy. Okay, so we talk about performance enhancing drugs. We've got to make some distinction between performance enhancing and therapy. Okay, therapy is something that is benefiting your health versus performance enhancing, which is benefiting your performance. Right, there's a big difference. So how do we distinguish it at a professional competitive level? We could also say medications such as Panadol, anti-inflammatories, Nurofen, Celebrex, Meloxicam. If I take that, I am reducing pain and therefore increasing performance. All right. Someone who's an asthmatic, such as myself, if I take my Ventolin or my budesonide or salmeterol, all of these medications that I use for asthma, short-acting, fast-acting, preventative, or a curative for the symptom. There's different types of classes of asthma medication. They are not performance enhancing. They are performance enhancing for me because they stop me dying, or if I had some injury and I had inflammation and I took an anti-inflammatory, yes, it's performance enhancing for me because I've got that symptom, but it's not by definition a performance enhancing drug on the basis of if someone who doesn't have that symptom, someone who does not have asthma, someone who does not have inflammation in their lateral collateral ligament of the knee, or a labral tear, or a bit of supraspinatus tendonitis, okay? If that person next to me takes the same drug, it has absolutely no benefit on their performance, okay? It has no benefit on their performance. So therefore, it is not a performance enhancing drug. That's how we define it. That's how I would define it as a clinician. Okay, so BPC, Taylor is taking some drug peptides. Okay, it's just a protein that helps improve the rate of healing, or so the purpose of it is. We don't fully know whether. I don't think the science is out long enough to know at what percentage, or if insignificant or not. Who knows? Maybe it's a placebo. Maybe there is good evidence. I haven't gone haven't dived into that. And also a lot of these research articles are heavily biased by manufacturers. But nonetheless, if two people take it and someone who doesn't have the injury doesn't get any performance benefit out of it, I don't believe it should be a performance enhancing drug. If you don't have asthma, you're going to get no benefit from taking Ventolin. In fact, you'd probably get a deficit. You're going to get no benefit from taking budesonide because you don't have the condition that the drug is a therapy for. Okay, so it's not that complicated, for goodness sake. As opposed to growth hormone, high dose testosterone, SARMs. I could take that, and someone next to me could take that, and we would both get performance enhancing benefits. We don't have symptoms, so of course it's a performance enhancing drug. And then we make arbitrary decisions that, you know, caffeine and creatine and other medications, you know, bicarbonate of soda, are not on the banned list. THC, it's arbitrarily deemed to be a banned substance during competition, but not out of competition. So, you know, yeah, I think there has to be a level of common sense. But one of the major determinants of whether a agent is performance enhancing or not is if I give it to someone without the symptom as a therapy, is it going to improve? Is it going to help them? The answer will be no. And for all those medications that I mentioned, or the therapies that I mentioned, including the peptides for healing and platelet-rich plasma (PRP), they're not going to help anyone who does not have the condition. Ventolin, Pulmicort, Symbicort, all of those medications, Meloxicam, Nurofen, Panadol, they're not going to help. In fact, some of them may hinder performance. Okay, so what does that mean? It's absolutely insane that Taylor Self has got a 4-year ban. It just doesn't make any sense. It's just protocol guidelines, which, yes, they're very good checklists, very good. You know, I want my pilot to go through his checklist before he takes off. But protocols, guidelines, checklists also have a downside in that they stop people using their brain. They just stop thinking when they've got a checklist or a protocol to follow. And so I think sometimes protocols like that need to have a little bit of thought put into those decisions before they're reflexly determined. Okay, talk to you next time. Bye.